Welcome, everybody. This is Mind Your Body and Soul, the healthy podcast brought to you by Neighborhood Medical Center. I am one half of your host. My name is Joseph Ward, and my co-host, his name is
Mathias Sweet.
Yes. And this is the All Things Health podcast. Make sure we covering the mind, body, and soul, holistic approaches to making sure that we enrich, empower, uplift, and mobilize our community into being a healthier community, right? So we're going to introduce ourselves, get deeper into ourselves and what we do at Neighborhood Medical Center, what we do in the community, and who this lovely young lady is that's on our screen. So, well, let's start there. Ladies first. Miss Steeple, could you introduce yourself and tell people what you do here at Neighborhood Medical Center?
Thank you, Joe. I appreciate that. My name is Alana Steaple, and I am the Ryan White nurse practitioner. I think everyone who comes in contact with me know that I love what I do. I love taking care of the patients, and I love serving the community. And that's really what the Ryan White program is all about. Right. It's really taking the time to take care of the community yep. That I live in.
Yep. We're all we have. Or like they said in New Jack City, we all we got.
We all we got.
Right. So Mathias, what do you do here at Neighborhood Medical Center?
Well, right now I'm the Ryan White program director. So I make sure the program runs effectively and efficiently, making sure that the patients have what they need. If they don't have something, I figure a way out, any means necessary to figure out how to give them medication, making sure they get appointments, making sure that their care is totally met by any means necessary that we have to do at Neighborhood Medical Center.
Right. And when he says by any means necessary,
he means
you better believe it.
Necessary.
You better believe it. So once again, I'm Joseph Ward, and I am the outreach specialist and health educator here at Neighborhood Medical Center. And my job is to make sure that our outreach program is actually functioning, make sure our outreach program is out in the community, making sure that we're in schools, we're in nursing homes, we're in juvenile programs, we'll come to your cookout, we'll come to your barbecue, any venue who will allow us to provide HIV testing, syphilis testing, as well as education, we will be there. We have a mobile unit that we'll take this mobile unit anywhere in the 8-county area because we do cover the Big Bend area. So we're everywhere, and we have multiple ways of bringing you services, and you will find that out. That's one of the reasons we created this podcast, so people can learn more about us. So, Mathias,
yes,
could you start this part off? Because, you know, a lot of times we're out in the community and we're asked people, well, do you know anything about Neighborhood Medical Center? And some people know about it, some people don't know about it. So could you start this conversation off by telling people what Neighborhood Medical Center is and giving some background information about it?
Sure. Well, Neighborhood Medical Center has been in existence for over 40 years. Over 40 years. And we actually have 5 different locations. Where you can actually get primary care, mental health, specialty care, GYN, OBGYN services. You can get mental health. We can do dental. We can do pretty much everything a regular doctor's office does for people with insurance and without insurance. Neighborhood Medical Center is here for the community, and we're actually here to help the community. A lot of people don't know that you can go right here to Neighborhood Medical Center and you bring us the correct information. A lot of stuff could be taken care of for you without you even having to worry about it.
Right.
So our goal is to make sure we spread that message. But Neighborhood is a great place to be. We're here in the community. We have, like I said, 5 different locations. And we're in the heart of Frenchtown at 438 West Brevard Street inside the Lincoln Center. We're in the Vaughn community, which is 2295 Pasco Street inside the Smith Williams Service Center. We're also over off of Orange Avenue at the 872 West Orange Avenue location inside the Richardson Lewis Health Department. We're also over across the way at the Rickers High School at 3013 Jim Lee Road inside Rickers High School, as well as we have a new location. I'm not quite sure on the address of the exact new location, but it's coming to you soon, and it's right there on the heart of the South Side. So, plus we have our mobile unit, like Mr. Ward said, we're going everywhere. Anywhere we can go to make sure that we bring health education, awareness, to the community. That's what Neighborhood Medical Center is about.
Right.
That's correct.
Appreciate that. Appreciate. Ms. Steeple, you want to add anything to that?
Well, being the Ryan White provider, I really wanted to give a little bit of background information regarding Ryan White. As a matter of fact, this year, 2020, is the 30th anniversary of the passing of the Ryan White Care Act.
Great.
For those of you who do not know, Ryan White was a young man, a young man back in 1984. He was what we call a hemophiliac. He had a blood disorder. And unfortunately, someone who had the human immunodeficiency virus, or HIV, donated blood. Well, back then, blood products were not screened as well. Nowadays, the screening is perfect. Well, unfortunately, they donated, and when that one bag of plasma went out to like 10,000 people, well, 5,000 people were infected with that. And because he was one of the individuals who received that plasma bag that had had HIV in it, he became infected with HIV.
Oh, so you busy.
So unfortunately, his community was not very unkind to him. And I tell you, he became the face of HIV/AIDS, spreading the information and education, and voila, the Ryan White Act was born.
Right.
So it's exciting to know that Neighborhood Medical Center has the Part C portion of the Ryan White grant.
Now hold on. I want to leave you right there real quick, because I thought of something. Because Neighborhood Medical Center is a FQHC, and we say that a lot. But either one of you could answer this, but could you break down what an FQHC is and how it affects people being able to access care before we jump right back into the Ryan White?
Yeah. Mathias?
A FQHC is a federally qualified healthcare center. That means that we get funding from the federal government to see people without insurance, who have insurance, but are, most insurances really don't cover a lot of stuff. So we're here to fill in that gap for that underinsured person. And so that's what a federally qualified healthcare center does. We're kind of almost like a one-stop shop in a way. We have pharmacy services. So everything is all included into one whole thing, which will take care of the holistic care of a patient, not just seeing that I'm going to this doctor here, I'm going over here to another doctor. We try to take care of the holistic care for people in the county and also in rural counties, because we do have one location that I did forget, which is our Havana location, which is at 604 East 5th Avenue. And that is actually in Gadsden County. So that's one of our rural area populations. So we do go to Gadsden County. And like Joe said earlier, we do go to the different surrounding counties, but a lot of the counties we go to when we're asked to come and when people are requesting services such as health fairs and things like that, we're able to venture out and do those type of educational services.
Right.
But that's what an FQHC does. It's in the community to assist people with insurance as well as people without insurance and people who have insurance but are underinsured.
Right.
And it's in the community, by the community, and for the community.
Yes, it is.
So and that is the beautiful part about the Ryan White program. The Ryan White program is just like a FQHC. It's a comprehensive system that provides medical care, support systems, as well as, get this, when a person comes into care, they get into treatment. When they get into treatment, that means that that's a form of prevention, because if they are virally suppressed, which is when the HIV viral load goes down, they're not transmitting the virus. So really, the Ryan White program and the FQHC, they're just like hand in glove.
Right. So earlier you were saying, Ms. Steeple, you were saying, and excuse my little fax machine in the back, we busy over here, but you were saying our Ryan White program is a Part C program.
Yes.
Okay. For our listeners who don't know what Part C is. It's not a rap group or album that's coming out soon, right?
No.
So could you break down what the Part C is within the Ryan White Care Act?
Sure, sure. The Ryan White program has 5 parts. There's Part A, and you usually see a Part A facility in the major cities like Orlando or Jacksonville, Tampa, Miami. And then and by the way, those Part A facilities, they're huge, they're large, and sometimes a city can have several Part A facilities in there. Part B stands for case management, and they provide the services that actually links the person to a Part C provider, or they provide transportation services, or just really case managing a person's medical care needs. Then there's Part C. Part C, we serve individuals from 18 until the grave. Okay. And those individuals, they come in, some people say, oh, Ms. Steeple, can I see you? I'm 17, but I won't be 18 until 6 months. And I'll say, shh, don't tell anybody, I'll see you, come on. So usually we see individuals 18 until the grave. And then Part D is women, infants, and children. And they see women who are expecting, women, they actually see them postpartum, and then they see the little babies. If the baby, unfortunately, it becomes infected, and they see small children up until the age of 18.
Okay. And so, Mathias, I want to throw this one towards you. Okay. Because and this is 2-part, but I'm gonna do this part first, and then we'll come back with the next part. So Ms. Steeple broke down Part A, B, C, and D. So could you tell us about the different agencies in the city or in Leon County that provide the Part A, B, C, and D services?
Yeah, Part A, we don't have anybody in the Leon County and the Big Bend area that really services A. Like Ms. Steeple stated earlier, it's in bigger cities. It has population. It's more of a metro city area type of grant. So like she said, that's the Jacksonvilles, the Tampas, the Orlandos, and sometimes those agencies cover the one whole area. I've seen it to where it's been like Alabama. Alabama has one agency that has the whole state of Alabama for their Part A. So it's a lot of different parts that go that way, and it's just because it has to reach a bigger population area. The Part B agency here is Big Bend Cares. The Part C agency is Neighborhood Medical Center, yours truly. Part D is Bond Community Health Center. And then there's another part that Ms. Steeple kind of forgot about that there's not that many out there, is Part F. Which is our friend. There are the AIDS Education Training Center. So they're the part that actually helps us with educating the staff as well as the community on updates on HIV, as well as how we can treat, and they link us to a network of physicians and other healthcare providers that we can talk to and get education, and sometimes even do telehealth communication to help treat the patient's needs.
Cool. All right. So our Ryan White team, because it's more than us 3. We're a part of the Ryan White team, but it's more than us 3. So Mathias, could you give the breakdown of the Ryan White team?
Yes. The Ryan White team consists of myself, which I'm the Ryan White Program Director. I have Mr. Joseph Ward, our community outreach person, as well as our health educator. We have a case manager. That person is not here at the moment. We also have a medical assistant, as well as we have the 2 providers who see our HIV patients, which is Miss Alana Steaple and Miss Marcia Roberts-Morris.
Thank you. And eventually, you guys, our viewers, you'll get a chance to meet the whole team. We're the ones that just like to talk. So here we are.
That's right.
You know? So Ms. Steeple, how long have you been a part of the Ryan White program, and what's the most rewarding part of your job?
Oh, wow. I've been a part of the Ryan White program since its came here to neighborhood, and that's going on what, 7 years?
Yep.
And so the most rewarding part of my job really is to see someone who comes in and they feel hopeless. And I tell them, I said, listen, when I look sad, you look sad. If I'm not sad, don't you get sad.
Right.
And to see them come from someone who is broken to someone who is whole, they feel good, they want to go out there and enjoy the sunshine, enjoy their family, their friends. That is the most rewarding part of my job. Now, the medical portion of me, I love to see it when their viral loads are undetectable. That makes me feel so good, and their T cell count is up. But if you really want to know, I think it's that other side of me. Love is seeing a person love life. That's the best part. That's the best part of the job.
Okay, so Mathias, and I'll answer this question too, but Mathias, as the Ryan White Program Director, because you've been around since the inception of the program itself. What's the most rewarding part of your job as the director?
Well, the most rewarding job of my part is being first and foremost is to be able to work with such great staff like yourself, Miss Wright, and Miss Morris and Miss Steaple. That's the number one thing. And the second part really is to able to see the patients grow, because they come in and they're lost. Because the minute somebody tells you that you're HIV positive, your life has changed that day.
Right.
It's not changed for the worse.
Right.
It's just a lifestyle change that we have to go through and make and say, hey, my life is changing. It's time for me to go. Like we learned on our training, it is not the new normal. It is the new
now.
And so for now, we got to take care of our now. And so finding out that they're down and things like that, and then able to see the process go from when they're sick and actually taking them into now they're calling saying, hey, I'm just calling to tell you I'm doing good. You know what I'm saying? Not always calling to say, oh, I'm not feeling well, or this is wrong, or that. I'm just calling to check on you. That's the most rewarding part, because they see we take care of them as a family, and they see that we're family and we're here for them. That's my best part.
Well, Joe, I would like to ask you, since you outreach. I mean, outreach is, people sometimes will think that outreach is easy. Outreach is difficult. Okay.
Right.
Okay. There are some days where I go, thank God I'm the person. Okay. Because outreach can be tough. So I know that you and Mathias actually go out into the community, but what do you find most rewarding about outreach?
When we teach some of our patients, we teach them about safe sex practices. So I'll give you an example in the story. We were on FAMU campus. And Mathias knows what I'm talking about. The guy is one of the students from Jacksonville. And what's funny is, if you go off of, if you're a person who reads a book by its cover, you probably wouldn't think this young man would actually adhere to safe sex rules because of stereotypes and things. Now, Mathias and I, being in the community long enough, we know better than to judge a book by its cover. But I'm just, kind of setting an example for this. So we had a young man who unprotected sex was his thing. Like majority of the students we come across, unprotected sex is their thing. So we introduced him to the Lifestyle non-latex condom, which is a thinner condom, and it heats up to the body temperature of the person it's been inserted in. So after a while, you have your full protection. The condom is on, but you get the natural feeling.
Okay.
So we told him about the condom, and was like, hey, you didn't pay for it. So if you don't like it, it's not like you lost money, just don't pick it up again.
Okay.
And so we gave him the condoms. So we test on FAMU set every 2 weeks. So so a week passed, we didn't go. The next week it was our time to go. And he almost jumped in our arms when he saw us, because he was like, man, y'all right. Like, you are right. Like, this condom is the greatest condom. And he was just so excited. And then he started telling his friends, and they started telling their friends, and they started telling their friends. And so even he was so grateful that it would be times when we were coming up, and he'd be by, he still come by, he still speak to us. And so other students are debating with us whether if the Magnum is the greatest condom or anything. So he'll come up and say, bro, look, they told me this, they told me that, I did this, I did that, use that, trust me, you're gonna like it. And so they're taking his word. So that's one of the most rewarding parts to me, is to see the information, see the way we give information is actually used, and it's helping somebody be safe and healthy in their lives. And that just makes me feel so good.
Awesome. What a great example. That's an awesome example. I mean, because students are more apt to believe their peers.
Right.
Than these two men who come up here in the mobile unit, they're more apt to believe them. And really, if something doesn't go right, they're not going to come back to you two. They're going to go back to their classmate.
Right.
And they're going to debate that with him. What about you, Mathias? You do outreach as well. What do you find exciting about it?
The outreach is one of my hearts. You know what I'm saying? The Ryan White program is my heart. But another piece of my heart is that outreach, because you're the first person that actually gets to interact with these people, well, not people, our newfound patients. Because a lot of times people don't know about the services you offer, and they don't understand everything that they can go about. So like when you're sitting down talking to people and you're explaining what you do, what you offer, and just hearing, I didn't even know you offer that. I just thought you were a free clinic, or I just thought you just go here and have a code. I didn't know I could go here and see a diabetes educator. I didn't know here I could go get infectious disease care. I've been out of my care for a long time. And then to find somebody that looks like them and that's young like them, actually educating them, it's a big difference. And you see it because the students come up to us with questions. Like, I didn't even know, like, can I call you because I have a friend who's going through something that I think you might can help with. So just the enjoyment of them knowing that we're a resource. And I love to be used as a resource for the community, because that's what I'm here for. That's what I went to school for. That's what my heart and passion is. And if I didn't have the passion to help drive it, it wouldn't make us such a great outreach team. Because me and Joe both have compassion that if people see us out in the community, it's me and Joe. Or the people come up to me, because I don't know how many times I came up to me in the grocery store, or someone say, man, can you tell her I'm okay? I'll be like, I can't.
I don't know you.
I don't know you. Only because it's a HIPAA law. How much I want to say, I'm so excited to tell you, yes, he's doing what he's supposed to do, but I can't break those kind of things. And so that's the enjoyment, is seeing them come back, retaining the information that we give them, and knowing that we have actually got the chance to change and make somebody's life with safe sex prevention and education. That's the main thing, actually getting people into care.
So I'm curious, but and I'm gonna ask this question real quick before I jump into some quick shout outs. But Ms. Steaple, what made you get into public health? What made you get into nursing?
Really, it was just wanting just to take care of people. But ask me what really piqued my interest in HIV. Ask me that, Joe.
What really piqued your interest, and not just being nursing, but HIV specifically?
Okay, believe it or not, in 2012, Joseph Ward actually did my 500-501 class.
Me? Oh.
I still have my certificate that has his signature on it. And he was so passionate about the sexually transmitted diseases and getting the community educated. And at the time, I was working at the health department. And I would come into contact. I was doing women's health and OB. And I would come in contact into these young women that I was like, what did he say? I need to try. And guess what? I tried out a lot of Joe's strategies and they worked. Good. So I said, okay, I'm loving this. I'm loving this. I'm preventing somebody from going down. They can go down this path or this path. That the path that's green that says go, that's the path I want them on. And so ever since then, I have just been attracted to the public health, community health.
Good. Cool. Now I appreciate that, Ms. Steeple. Because those 500-501 classes, especially those weekend classes, because there were plenty of months where I had maybe one or no weekends off because I was doing 500-501s. I believe I've trained over 1,000 people in my time doing 500-501. But I really enjoyed it, and I'm happy that you took the information and just ran with it. And you scored so many touchdowns. You like the Deion Sanders of this.
I don't know who Deion Sanders is, but I'll take that.
Just know you the best. Deion is the best. Okay. So Mathias, what made you choose public health and just the HIV path? What made you choose it?
Well, public health really struck home. Well, healthcare period, because dealing with my father and taking care of him in his last days, that really gave me that part to say, you know what, I really want to see how much more I can do. So that's the part that helped me. But HIV, I found it to affect people that look like me, act like me, in my community, in my church, in my school. And it's just like, it's all around us and we just don't even know it sometimes. Because you can't just tell if somebody's affected by HIV. And when I say affected by HIV, doesn't mean you have to have HIV. But you could be dealing with your brother, your sister, your mom, your dad, your cousins, your best friend. And so just knowing that all these people are connected and you're here, but you still don't have a good understanding of what HIV really is.
Right.
Or how it can be spread. And how you hear the stories of people just saying, oh, well, they can't eat off of this. They got to eat off all plastic silverware and plates when they come to my house. But you can't get it that way. So just being able to educate the community, that's why, because people always are downing people and everything. And that's not my personality. I don't think that's any of the Ryan White team personality. Right. It's just about uplifting people and educating. And so that's what I really got into it for, is because it's something that's misunderstood a lot. And people just need to have a better understanding of things they really don't know. So that's why I really got into public health and HIV.
Cool. Now, what's funny though is I didn't choose HIV. HIV chose me.
I know that's right.
You know, and like I'm so serious about that, because coming out of college, I was throwing newspapers. I had just quit my job at Goodwill, couldn't do that no more. And I was throwing newspapers for Tallahassee Democrat, and waking up at 2 a.m. throwing newspapers for $333 a month. That's for the birds. That's for the birds. And I'm like, I got a college degree. I'm out here. I'm making $333 a month. Like, come on, man. I can't even eat cheeseburgers with this. But an opportunity opened up at the health department. Sam Carter, Mr. Leroy Jackson, they gave me an opportunity to start off as the director of the sexual violence prevention program. And so that was the guys, sexual violence prevention. And you know, my first day walking in, my eyes were this big, because I'm like, I know nothing about sexual violence prevention. My depth with sexual violence prevention, or even domestic violence at that time, was watching Tyra Banks' show and getting mad at all the stories and stuff, right? So I got the opportunity to start at the health department under Mr. Leroy, and he was adamant from the beginning. Okay, you are the director of the sexual violence prevention program, but you do HIV/AIDS as well. Oh yeah, so let me go ahead and show you how to be a 500-501 trainer. So within my first month, I have like 5 certifications that I didn't even know exist. Now, remind you, when I got the job, I had no idea that public health was a field. Look, everything that I know about public health now is on the job. I had no idea this world existed. My knowledge of HIV/AIDS was what I saw growing up, and just the normal miseducation that people normally get. And so I was given an opportunity by two gentlemen that I feel like I made good on. I was able to create something for myself that I didn't have. I was able to meet people like you two. Like, cause me and Mathias, we linked up, what, 2-3 years before I even came over the neighborhood. And like our annual drag show, this if COVID go away, this year will be our 6th year. But I hooked up with Mathias while I was at the health department, because it's when we started doing that. Both of us started working on our flyer game with post on my wall.
That's right.
And everything. And it's like, this has been the best job I've ever had, doing HIV/AIDS prevention, doing sexual violence prevention. I'm able to educate people, help people, and just the look on people's face when you help them change their lives. And so it's amazing. Like, and I appreciate you two and everything that you bring to the table, because you all make my job easy.
Likewise.
No, I can honestly say, I just sit there and wait for the patient.
Right.
I just wait for individuals to come and say that they have met Joe or Mathias. And the beautiful part about it is that you really can approach anybody who works here at Neighborhood, and they will guide you. If it's our services that you need in the Ryan White team, they will guide you directly to us. Yep. And that's why it is a wonderful thing to work for a community health organization, an organization that desires to take care of its communities and the surrounding community.
Right. And real quick, we want to give some shout outs or some thank yous. Mm-hmm. First of all, now this young lady, she left our Ryan White team, and we've been crying ever since. But I feel like she deserves her flowers, and I feel like this podcast wouldn't be right if we don't give her her flowers, because we wouldn't be here without her hard work, her dedication, and everything that she put into this team, into her patients. Mr. Molly Charles, when you see this, look, we love you and we appreciate you. You are the truth.
Yes.
You are definitely a valued team member. We can't replace you. We're not looking to replace you, but you got a special place in our heart. So thank you for everything that you brought to this team. You brought to our community. You're not even from Tallahassee, and you cared more about this community than a lot of people from here. So definitely thank you, Damali. Thank you,
Molly.
Thank you, Damali. Right. Miss you.
Ms. Janae Freeman, our CEO.
Yes.
Thank you for just like she allows us to do our job.
She does.
That's right.
That's right. And of course, we do our best not to come with crazy ideas. But she's not a burden. She's not a barrier. She's a great leader. I appreciate her leadership. I appreciate her support, everything that she does for this organization, but especially the Ryan White program. That's why she gave us her blessing to do this. We're here. That's right. So
that's right.
Thank you to her. Miss Marcia Morris. Thank you, Marcia.
Yes. Like my partner in crime.
Right. Like,
thank you for going to all those outreach events, even though it's on the weekend. I really want to thank both of you guys, because y'all step up. Y'all are one of the 2 providers. If we say we got an event, y'all are right there. Y'all like, I'm on it. Where we going today?
Right.
What we gonna do? I'm ready.
Right.
So, I mean, I really appreciate both of you guys, and Joe, I really appreciate you as well, because this wouldn't be possible without you. This is one of your visions that you had and you set forth, and you've seen it come to fruition. So I'm really proud of you as the outreach person, the health educator, and just seeing your growth. I'm really proud as a manager and a supervisor to see the growth that you have went through, and I'm extremely excited for you and to see where you're going. Ms. Steeple, as a provider, I promise you, there's nothing else that I would ask for another provider. We might bump heads some days, but
that's family.
That's family. And like I say, we treat each other like family. And again, to tap on Janae, I really, really, truly couldn't ask for a better supervisor or CEO of any organization that allows us to follow our dreams, our passions, and just what we can do. Because like Joe says, we do some unconventional stuff that most people be like, you got to be crazy, you finna do this. But we turn it out and we turn up a good show, and it's there. And that's what it's about. We're about making sure we reach the community. And we know as outreach people and as the Ryan White team, we have to sometimes go to where our patients are. And our patients aren't always going to come to us in a building. We might have to go to the projects or to a night event or somewhere else to actually assist people. But that's what our bosses will allow us to do, and they're okay with it.
And they will come with us.
And they come with us. They show up, they show out, and we do it.
I do have two special shout outs.
Me too.
Melanie
Wright. She's a very important part of our team.
She's my left and right hand.
Right.
I cannot do it with
She's our
Merle.
medical assistant.
She's the medical assistant, and well, actually, she's more than a medical assistant. She does a lot.
Yeah.
And so I want to say, and also to Dr. Sharon Foster, who is very, very, very supportive of the Ryan White team. So really, I couldn't go to 3/4 of the seminars that I attend, that Marcia and I attend, without her support as well. So but I hope, Joe, Mathias, I hope what everybody sees is that no one is an island. We cannot, neighborhood medical center cannot provide the best care to its patients in the community without each other. It's hand in glove. It's hand in glove. So if you're thinking about a hand in glove medical organization,
come on over to Neighborhood Medical Center. Right. And further, can't forget Mark Ian, who are head of our IT. Hey, look, trust me, we wouldn't be here right now. Shout out to Mark. Appreciate you, Mark and Ian. Thank you all for everything you do. Jacardi. Jacardi Dennis, thank you for what you do with our outreach. Emily Edwards and Shemaya Smith, thank you all. Because these, and we're naming these names because these are people who work in Neighborhood Medical Center, who don't work a part of the Ryan White program, but whenever we need help, they never hesitate to help us. So we want to make sure that we recognize everybody. And if we forgot somebody, we apologize. So everybody, we love everybody.
Mr. Gaines, Mr. Black?
Yes, Mr. Oh, yeah, definitely Mr. Gaines and Mr. Black.
And we can't forget Miss Black for always coming through.
Yes,
Miss Black. I've been needing the blood pressure and glucose, and she be right there on time.
Right.
See, if you need or want to be a part of a family, you got it. A ready-made family.
If you looking for a family, you tired of somebody being all in the videos, come to Neighborhood Medical Center. No, but I want to before we wrap this up, we've been greatly affected by COVID-19. Before, or AKA the Ronas. So before COVID hit, we were out at least 3 days a week doing outreach. We had patients, the flow of patients coming in and out. So from your perspective, start with you, Ms. Steeple, from your perspective as the provider, how has COVID affected the way you work, and what changes did you have to make to be able to make sure you still meet your demand?
Well, I think the biggest thing is that I have moved from the in-person clinic to telemedicine. And you know what, the beautiful part about it is that I thought the patients were going to moan and groan. Not. I want to say several of them are like, Miss Steeple, we love this telemedicine because they can be in the grocery store talking to me. They can be on their back porch doing a video chat. That's one change. But then also another change is that I've noticed that, you know, since the universities are closed, I don't see the younger population of students where you two, Joe and Mathias, the two of you go out and you test these students, and those who come back positive, they come here to neighborhood.
Right.
And so I do miss the college population. I know that they will return, but those are the two biggest things. The telehealth has been a blessing, total blessing, to so many, the majority of the patients that I see. But at the same time, I do miss the college students.
Yeah, we do as well. We do as well. So Mathias, as the director of the Ryan White program, you know, we got all these COVID changes. How has COVID affected the way you work, and what changes did you have to make?
Well, some of the changes are for the better. I just feel like this new now has actually pushed us to the level where we need to be. Only because a lot of people were talking about doing telehealth, this and that. So as a director, you always look for, and as a manager, you always look for how you can grow your programs. And so when we're sitting here doing regular primary care, or it's HIV care, or whatever kind of care it is that you're trying to hold for somebody, you have those barriers. And I just feel like COVID actually has allowed us to conquer a lot of those barriers that we were having trouble with conquering before. A lot of people don't have transportation.
Right.
So they got a phone. They got a cell phone. Whether it might not be the updated phone, but it's a phone they can get on the internet with.
Right.
It's a phone that they can communicate with. So that has allowed us to bridge those gaps with those people who are not able to get into the clinic all the time. Right. Or for the people who, my car is broken down all of a sudden. Now I don't know what I can do. I've got an appointment, but guess what? I can still pick up that phone and click that link. Boom, I'm right there at my appointment.
That's
so
right.
They don't have to make the excuses no more of, I can't get to the clinic, it's too far, it's not convenient. So that's one of the challenges that COVID has made for the better. The sad part is people aren't doing what they're supposed to do as their part. And it's hard trying to make sure, because you don't want to be the mask police. You don't want to be the person that goes around and say, hey, put your mask on. But sometimes it takes that time for it, because in educating the patients itself on what they need to do to protect themselves, because all they see is what's on the TV, and they see a press conference here, they see this here, everything's contraindicating and saying, no, do this, no, do that, no, do this. But they need people in the community to be able to say, hey, I need you to listen to me. I need to be a gatekeeper, our gatekeepers to come through. So that's what I really think that COVID, the challenges has done, because we're out here doing it. We're doing the work. The work is showing. The numbers are increasing. That means we're doing our job by testing. That means we're doing our job to find the stuff. Even though numbers might be high, but we're doing our part so we can get to the end point. And so my thing is, I just think it's a great change because it helped us move towards the technology, the new now.
That's right.
So that's my whole take on it. You got to think the positive part.
Yeah.
Say, hey, it jumped us to the new now, because now we're able to do telehealth groups, telehealth podcasts. We're able to do all the stuff that we weren't able to do now that everybody's comfortable with, and just thrown into it and saying, hey, this is our new now. Let's take it on and let's run with it.
Right. Yeah. Because I know for me, I really miss going into the classrooms. I miss going into the projects. I miss being in the streets with the people of the community. Like, we love our community members. So thinking outside the box, Mathias and I was in the office just talking about different things that we could do to keep our presence going. So within a month, we can average about 300 HIV tests in a month.
Right.
So with COVID out now, we have to tweak the way we provide testing. So moving forward in the upcoming weeks and months, we will be returning to HIV testing. It'll be in a more controlled environment. We won't be able to go to as many different environments as of now, but we will be coupling. We're doing our best to try to, and cross your fingers, try to couple HIV, syphilis, and COVID testing. So that way we can hit more than one thing at one time.
Right. That's
so
right.
Another is, like we say, this podcast, Mind Your Body and Soul, the number one health podcast out. Let's claim it.
That's right. That's right.
Our Healthy Happy Hour has gone virtual, and Healthy Happy Hour is an event that we hold the third Thursday of every month, where we invite a professional from anywhere in the health realm or any information that could lead to good health. We invite those people in to speak, to give their information to the audience. It's a free event. We will normally feed you, and you get free information, free food, and you get to see my face, right? So,
right.
But now with COVID, we've been affected by that. So we had to go digital with our Healthy Happy Hour. So if you go to our Neighborhood Medical Center Facebook page, you will see our first virtual Healthy Happy Hour featuring Ms. Janae White of the Girls to Be With Mentoring Program. We talked about mental health. It's on our Facebook page. Now go check that out and make sure you like our Facebook page.
I'm also going to add it to the website as well, Joe.
Say it again.
Yeah, the
website. Our website as well.
Yes, it's coming to our website very soon. Neighborhoodmedicalcenter.org.
The great part about it is different platforms, same education,
right,
same valuable information that you would get if you were to come to Healthy Happy Hour in person. We just changed the platform. That's
right,
all.
Right. So we're wrapping this up. Neighborhoodmedicalcenter.org is our website for you to learn much more information about neighborhoodmedicalcenter.org. Things you can look forward to with this podcast is more of us three giving more information about HIV/AIDS, healthcare, the Ryan White program, all things health, and we will have health professionals from around as many as we can find from around the world, from many different realms of health, mind, body, and soul. So those are things that you can expect from us. Great conversations, poignant conversations, real conversations about what's going on in the community. And we'd like you all suggestions as well. If you have topics and things that you want to know about, you want people that you like, professionals you want to hear from, let us know. You can comment on these videos when we put them out. You can email me. I give up my email, joe@neighborhoodmedicalcenter.org for more information.
It's J Ward.
Oh, yeah, I'm sorry. He know my email better than me. I'm thinking about all my jward@neighborhoodmedicalcenter.org. That's right, jward@neighborhoodmedicalcenter.org. So that way you can get more information about things we have going on, upcoming events. And hopefully this COVID dies down soon. You guys got any parting shots you want to give before we close this out?
Not really. Just make sure that we'll post our contact information below the video, so everybody can have our contact information so they can reach out to us and, communicate. Because like Joe said, we want to hear from the community. We're here for you guys as the community, and we really want to know your thoughts, your feedbacks. What do you want to hear? What else can we do to help improve the community that you live in as well as that we live in? We don't think of everything. So the more that we get from you guys, the more that we can help you out. So if you could just leave us thoughts, comments, good, bad. We prefer more good than the bad. But, hey, it's life. It's our new map. So just leave us the good stuff so we can actually help and bring more awareness to the community. That's all I got.
And remember 2 words, no judgment. No judgment. So please, if you're even thinking about coming in and wanting a rapid HIV test or a syphilis test or a COVID test, come on. Come on, remember, it's not just you, it's your community.
Yep.
So no judgment, please.
Right. And this was excellent. I appreciate you too. Great conversation. Just remember, everybody, to mind your body and soul. We'll see you next time.
Bye.
Bye.